Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at the 25th Annual Legislative Conference at Washington, D.C. We are joined today by the current president of the ACC, Dr. Rick Chazal. Thank you so much for joining us today.
My pleasure.
Dr. Chazal, can you tell us more about what is the ACC Legislative Conference? Why do we hold this every year? And what are the topics being discussed at this year's conference?
Well, for the past 25 years, we've come together in Washington to look at issues that are related to the legislative process that ultimately impacts how patients are treated in the United States. Being passive about this and just having it occur to you doesn't give us the input that we need in representing the best interests of good patient care. Some of that has to do with regulations that have to do with reimbursement or structure or anything that has to do with regulatory issues that ultimately govern the way that our patients are cared for. So it's our opportunity to educate ourselves about what's happening, but also then to meet with legislators, which is very educational, and try and give them direct input.
Well, great. Yeah, so that's why we have this conference every year. We do see a number of fellows in training here in attendance this year. Why is it important for fellows in training to attend this conference in particular?
Well, it's an educational process for all of us because much as we might be educated in electrophysiology or coronary artery disease, part of our obligation to our patients and to society is to influence the system, and we have to be educated. This is a CME event, not actually, but an educational event that begins to train you and me about how to engage in the process and make a difference. So I think it's an important piece to your education and mine as well to be able to continue to advance in that area. We've got to have people like you who are the leaders of today and of tomorrow who are engaging this process early. It's also important when we're meeting with government officials, with legislators, for them to understand the breadth of our membership and that we don't just represent a bunch of older cardiologists and cardiovascular surgeons and pediatric cardiologists and cardiovascular team members, but that we really are looking at the entire breadth. The other thing that I think is really crucial is this. The duration of my remaining career is a lot shorter than yours. So the truth of the matter is that what's happening now in Washington is actually going to affect your practice and your patients even more than it affects mine.
Well, finally, Dr. Chazal, for fellows who are interested in advocacy and want to get involved in it, apart from attending this conference, what other advice do you have for those fellows?
I always believe that, as Tip O'Neill said back in, 1935, that all politics is local. And so if you really want to begin to engage in this process, I think that the easiest avenue and the one that's most efficient is begin to engage with your state chapter. Do it while you're a fellow in training. They're very anxious to have your input and understanding and insight, and it starts to get you engaged with advocacy even at the state level, which is where a lot of this happens. So it's a great way to do it, and it's pretty easy.
Wonderful. That's great advice for the fellows. Thank you so much for joining us today.
It's always my pleasure to meet with you.
For more videos like this, please log on to youtube.com/fitsonthego.